The UConn Health Center is celebrating its 50th birthday by helping you stay healthy past your 50th birthday, and that is right at the same age where men have to start looking out for their prostate. But as Fox Connecticut's Tim Lammers reports, not enough men do.
Beth Roscoe knows how important it is for men to get screened for prostate problems.
My dad died in the late 90s of prostate cancer. Then coincidentally, a few years later, his only sibling, a brother, died of the same thing.
Her husband, Tom, was proactive about getting checked. And that's not always the case with men.
Well, it's not as though I had to badger him into it.
Actually, most people in marketing recognize that you talk to spouses, and they're the ones who goad their husbands into coming in.
10 years ago, there was something that came up in a physical exam. The only thing that was an indicator was the PSA.
PSA is a blood test. It looks for an enzyme called prostate-specific antigen.
So if you're over 50, consider this a public service announcement. A PSA for the PSA. It may provide the only warning sign you're going to get.
Most men with prostate cancer have no symptoms. In the U.S., I'd say 80 to 90% of men diagnosed with prostate cancer are being diagnosed because of an elevated PSA.
Prostate cancer kills more men over 75 than any other cancer. But it's a fickle disease. It's different every time.
Prostate cancer has a whole realm of outcomes, to very indolent, slow-growing that never seem to affect someone, to highly aggressive cancers that kill people even in their 40s or 50s. But the good news is they're not always lethal.
Now, some of you out there may have had a father or a grandfather or some other family member who was diagnosed with prostate cancer late in life and was told by the doctor that essentially they didn't need to worry about it because that wasn't going to be what killed them. Now, if that's happened to you, don't misinterpret it. You still need to go and get checked.
In the last few years, the PSA level started to go up. A biopsy then was recommended. Then I had the biopsy and it came back positive.
Tom had his prostate successfully removed on July 5th.
There was no sign of any spread. My latest PSA was undetectable,
which was huge. That was huge.
Usually when men get out 4 or 5 years and their PSA is undetectable, that usually means that they're cured of this disease.
Again, having a doctor you can trust and a wife that you have a strong relationship with was a blessing to me.
In Farmington, I'm Tim Lammers, Fox Connecticut.
And for more ways the UConn Health Center is helping you stay healthy over 50, you can visit our homepage at ctnow.com, where you can watch all of Tim's stories there. It is 6:47, and we are getting a check of the traffic. Rachel Lutzker is here.